Hello, my name is Phil Moore. I am a GP. I chair the Mental Health Commissioners Network for NHS Clinical Commissioners, and I'm Mental Health Clinical Co-Director for London. I want to comment on the situation with the reset of the NHS, and I want to particularly focus on mental health, which is where a lot of my time is spent. And if I was to reflect on what I've learned from the COVID-19 crisis, there are a few things. One of the things that has terribly impressed me is the huge commitment of clinicians, support staff, managers, in primary care, in the provider sector, and within commissioners as well. I've seen such huge dedication to the task of actually looking after people, despite all the pressures that are put on people and despite the personal sacrifice for many, for some even the ultimate sacrifice. And that has been hugely impressive. Often gone unnoticed is the critical role that commissioners have played as they've been enabling many of the rapid changes that have gone on throughout the system, and they will continue to use those skills as we begin to emerge into an integrated care system in each area. But those amazing relationships that have been formed throughout the crisis have really been beneficial, because I've seen the different silos of the NHS work together in an effective way to bring about very rapid change. Across London, I've seen work together to coordinate our response to the needs of health and care staff from a psychological point of view. We've worked together on suicide prevention related to COVID-19, and I've seen a different kind of relationship with the general public as a result of the crisis and the way that the health workers are working across the whole system. So where do we go from now? What is this reset and what is it going to mean to us? I think the key thing for me is that the reset is a chance to reimagine health and healthcare services when everything has been suspended. So no longer do we have to start from the place, well, what do we stop? But it's what do we start? And that's a fantastic situation to come along, and it's a once in a generation opportunity to make a difference to the way that we do things and to reset the way we do things and to change fundamentally our behavior and practice as a health system. I think if I was to summarize what I feel has happened with the crisis, I think it has been the acceleration of the inevitable. A lot of these changes were coming anyway. The massive change in IT, the changing expectations of people with healthcare, the fact we don't have to see our health professional every time, that can be dealt with in different ways. What we've got to do is to make sure that the bureaucracy doesn't return that actually gets in the way of the rapid spread of innovation. And we've seen that happen so well over this crisis, and it would be a huge tragedy if we were to see that disappear. We have to work very hard to minimize bureaucracy and enable the good ideas, the real innovation to spread without the kind of hindrance that often we experience. We also have to be ready for a predicted spike in the need for mental health services. And that's going to include primary care, community services, our specialist colleagues, IAPT, and many others. And we have got to work together to manage that. If primary care isn't geared up, we will overload our secondary care colleagues. IAPT won't cope if primary care isn't playing its part. So we really do need to engage everybody on board with this process. We need to look to trained peer workers, to the voluntary sector. We need to keep an eye on implementing the community framework so that we don't bypass that and do something different, because that will deliver true integration around primary care networks, where we can deliver the interventions and the support for those people who need it over this next coming period. Primary care is going to have a pivotal role in this. The system can't manage if we don't play our part. And so I think one of the things we need to do is to bring forward the engagement of mental health workers within primary care networks. And that means bringing forward the funding from April 2021 to as soon as we can, because in the next month or two is when we're going to begin to need them. And indeed, the increase in the presentations of mental health problems is beginning to increase already. We're also going to have to be creative about how we make the funding stretch to the new situation. We've got to do things differently. We've got to not pick up some of the things that we were doing that perhaps don't have the the benefit that they might have. We've got to do things more effectively and efficiently. I think that we've made real strides over the last few years, but we still have a service that has been traditionally underfunded for decades, and we need to continue to correct that. The mental health investment standard will continue to be there. Use that money differently so that we're more effective in what we do. So if I was to summarize what I think this reset of the NHS is, I think it is an unrepeatable opportunity for the future of health and care. We miss it at our peril. Thank you.